Cord care. Before your baby's umbilical cord falls off, it is important that you treat the cord during each diaper change and sponge bath. Simply dip a clean cotton swab into rubbing alcohol. Lift cord and thoroughly clean around the complete area by making sure that the alcohol swab gets into the folds. This will not hurt the baby and will dry out the area to help the cord fall off. Occasionally, there may be some normal bleeding from irritation to the belly button. Continue to apply alcohol. If the condition persists, call your pediatrician. After the cord falls off, any time between the first 10 days and 3 weeks, continue to apply alcohol with a swab or cotton ball for a few days. This will ensure that the area will stay clean and dry until completely healed. Sponge bath.
Told me she's dirty.
Most pediatricians suggest that you give your baby a sponge bath 2 to 3 times a week until the navel is completely healed. As in diapering, bathe the baby in a secure area with all the supplies you will need within reach. You'll need a mild soap, shampoo for washing hair, a soft towel, blanket, rubbing alcohol, cotton swabs and cotton balls, and of course, warm water and a fresh diaper. Before you start, always check the water temperature with your elbow. It should be comfortably warm. Place your baby on a soft blanket or towel, keeping her covered for warmth. First, dip a cotton ball in warm water, squeeze out the excess, then start to wipe the eyes from the inside away from the nose. Use a fresh cotton ball for the other eye. Using a damp washcloth with only clean water, wipe your baby's face one side at a time, making certain not to completely cover it with the washcloth. This could frighten her. Then, clean the ear and neck areas. Now you are ready to shampoo. To wash the hair, cradle him in a football hold with his head over the sink, tub, or basin. Then pour clean, warm water over the hair. When applying shampoo, rub briskly into a lather. Don't be concerned about the fontanelle or soft spot. It is covered by a tough membrane. Now slowly rinse with clean, warm water. Towel dry, then brush or comb to help prevent cradle cap. Using a mild soap, start to wash your baby's chest, arms, and hands. Remove the diaper and clean her bottom and genital area carefully, making certain that you clean in all the folds. Now, wash your baby's legs, thighs, and feet. If you have a boy who has just been circumcised, make certain that you clean the genital area with only plain, clear water. Then treat the penis with Neosporin or petroleum jelly as you did during diapering. After you towel dry, you may want to treat your baby to a baby lotion massage. This is comforting, relaxing, and refreshing to your baby's skin. Then cover your baby with a soft towel or blanket to keep her warm. Tub bath. After your baby's navel is completely healed, she's now ready for her first tub bath. A kitchen or bathroom sink will do just fine. When filling the tub, begin with only a few inches of water. Make certain that you test the water with your elbow as you did during the sponge bath. First, clean your baby's face and eyes with a clean, damp washcloth, as you did in the sponge bath. Now you're ready to bathe the baby. Gently place her into the tub so she will get used to the water. It's important that your baby feels secure and reassured. You can do this by constantly talking to her as you bathe her.
Are you starting to enjoy it?
Using a mild soap, clean her neck, legs, arms, and front. You can then sit her up to wash her back. This can be an enjoyable experience for both of you. Now that she's clean and happy, rinse her off with clean, warm water. You're now ready to shampoo her hair. Wash your baby's hair as you did during her sponge bath. Using the football hold, spray or pour warm water over her hair. Apply a mild shampoo while briskly rubbing to a full lather. Using clean, warm water, rinse her hair, then carefully dry, comb, or brush. Bathing can be a fun time of the day that you will both look forward to. Dressing baby. Since you'll be dressing and undressing your baby every time you bathe or change her, it's wise to buy loose, easy-access snap-on garments. While dressing your infant in a one-piece or snug-fitting outfit, hold her foot with your hand, then place toes in first. Place your fingers through the sleeve while slowly pulling your baby's hand through as your hand protects her fingers. Even though your baby may fuss a bit, after a few changes, you'll both become old pros at the dressing game. First doctor's visit.
Hello, Christian. How are you?
During your first doctor's visit,
Look how
your
active and alert he
pediatrician
looks
will
today.
completely check your baby's progress. Your doctor will check your child's lungs, heart, and overall condition, as well as his umbilical cord.
The belly button looks fine. It just, when did it fall off?
Yesterday.
Yesterday, that's fine. It's oozing a little. Okay, usually it'll dry up in a few days. Well, he's got his eyes open. I'm going to look in his eyes.
Your
This is my
baby's
chance.
eyes, stomach, and lower extremities, including his hips and legs,
His
will
legs
also
look
be
nice and
examined.
straight.
The doctor will be checking your infant for normal
All
reflexes.
right, Christian, we're going up now. We're going up. Can you see Mommy? That's okay. Look at Mommy. Where's Mommy?
No.
Hi, here's Mommy.
Big boy.
His head, size, and weight is usually measured to check for normal development.
Very good. Okay, we're all done, Mom. You can pick him up, get him dressed. I think Christian looks fine. He looks like a very healthy baby. And I just have a few questions for you.
After your doctor asks you a few basic questions, this is the perfect time for you to take out your list and ask him all the questions you have noted during the past few weeks.
I wanted to ask you, Doctor, about his heat rash. Is that normal to have a little rash on his forehead?
Yeah, heat rash is a very common condition in new babies. It starts in the first few days and it lasts for the first few weeks. And it's a benign condition. A lot of babies have it. It doesn't bother the baby. There's no need to put anything on the skin. And it will just gradually disappear.
We fly a lot. Is there any risk in taking him in an airplane at this
This
stage,
stage?
or what would you recommend?
I say, and most pediatricians will agree, that it's okay to take a baby after 2 weeks of age on an airplane. The only thing you want it to do is have the baby on takeoff and landing either suck on a pacifier or on the bottle or the nipple for equalization of air pressures. But I have no problem with the baby going on an airplane after 2 weeks of age.
Last couple of days we've had a lot of people coming over, and I was wondering, with reference to having older adults picking him up, kissing him, whatever, would you present having a problem in terms of being exposed to other people at this early stage?
Yeah, we would really like you to keep people away from the baby for the first 2 months of age, because you never know which person or child is harboring an infection inside. So they can be in the same room, but I really wouldn't like them getting close to the baby, touching the baby, kissing the baby, or breathing on the baby.